Thank you for joining us for another informative, educational, and entertaining edition of Music and Medicine with Dr. Charles Modlin, kidney transplant surgeon, board-certified urologist, public speaker, and well-known community national leader for the elimination of health disparities, dedicated to informing you, the listening audience, about important health topics and health information that you, your family, and your community need to know, while at the same time providing you with quality entertainment, because music and entertainment is medicine. Dr. Modlin's co-hosts are Jerome Brown and registered nurse Jonathan Branch, and the program often includes special content expert guests. So, without further ado, here is the host of the show, Dr. Charles Modlin.
Hello, everybody out there in the viewing audience. Thanks for tuning in for another exciting and informational episode of Music and Medicine. I'd like to thank Mr. William Reed for that wonderful introduction. We're so appreciative to be here with you this evening. We have a very special show. Our topic this evening is going to be on kidney disease and chronic kidney disease and kidney transplantation. Later on in the show, we're going to be joined by two of my kidney transplant recipients, Mr. LaVance Lining and Mr. Ray Freeman. And LaVance Lining is going to be our entertainer also. He doubles not only as a kidney transplant recipient, but as what he calls himself, the clean comedian. So we look forward to having a wonderful program this evening. I wanted to start out by alerting everybody to the fact that we have our Metro Health Minority Men's Health Fair coming up. It's just right around the corner, Thursday, April the 27th. That's the last Thursday in April. It's a free health fair open to everybody, regardless of race or ethnicity or gender. But what we're doing, we're trying to specifically reach men of color, because men of color have the highest incidence of healthcare disparities and the lowest life expectancy out of any group in the entire nation. So Thursday, April the 27th, that's the free Metro Health Minority Men's Health Fair. We're going to hold this health fair in 3 simultaneous locations at the Metro Health main campus on West 25th Street. We're going to be at this year also at the Ohio City campus, and we're going to be at the Cleveland Heights Metro Health campus. It's all free. The information to pre-register and the phone number to pre-register is on the banner on the screen, or you can just show up on the day of the event between the hours of 5 and 8:30 p.m. and register on location. I want to remind everybody, my book it's out, it's available. It's called It Isn't Difficult to Do It If You Know How to Do It. It's a book specifically dedicated to advancing the success opportunities for our younger generation. We, the older generation, have an obligation to impart upon the younger generation our skills, our wisdom, our knowledge, our advice, our guidance to help their success journey perhaps be somewhat less difficult, arduous than what we experienced growing up. So I encourage people to get the book. It Isn't Difficult to Do It If You Know How to Do It. It's available on Barnes & Noble online and also Amazon online. Why am I wearing my Northwestern apparel this evening? It's because the Northwestern basketball team was selected to compete in the NCAA March Madness basketball tournament. It's the second time ever that Northwestern has made it into the NCAA March Madness tournament. So I actually will make a prediction that Northwestern will be the national champion of the March Madness basketball tournament this year. I'm confident about that. So go Wildcats. I don't know if that show. Okay, yeah, Wildcats, Northwestern Wildcats. They're going to be number 1 this year. So I wanted to go ahead and kind of set the stage for our topic of discussion, which is kidney disease, kidney failure, and kidney transplantation. So Russell, if I can have the slides. So that is on the screen is a picture of me when I first arrived at Cleveland Clinic as a kidney transplant fellow. You can see how young I look. So I show this picture just to show how long I have been in this field of urology and kidney transplantation. I was the first and only African-American kidney transplant surgeon in the history of Cleveland Clinic. And I was the first staff urologist in the history of Cleveland Clinic as well. Just means we need to encourage others, young people, to pursue urology and kidney transplantation. And again, that's one of my roles and responsibilities to do that. Next slide. So we're going to be talking about kidney transplantation, and I hope nobody has any queasy stomach, but I'm going to show you some pictures of what a kidney transplant looks like. We call it a kidney allograft. That's a picture. With my left hand, I'm holding a kidney allograft. That's from a deceased donor. You can get a kidney transplant from either a deceased donor or a living donor. Next slide. And you can really see how generally, what is the size of a kidney in relationship to my hands. That gives you a perspective in terms of what the size is of a normal kidney. Next slide. I'm wearing the school colors of my son. He went to Texas Tech. Again, another slide. I'm preparing a kidney prior to us implanting the kidney into the recipient. Next slide. So again, that's a picture showing the vein. The larger structure there is we call it the renal vein, kidney vein, and the smaller structure is the kidney artery. Next slide. And again, just another picture of me holding a kidney. Next slide. So let me give you some facts about kidney disease. ESRD stands for end-stage renal disease. Renal just means kidney. It's more of a problem in the African-American, the Black communities compared to the Caucasian American communities. In fact, chronic kidney disease, kidney failure is has a 4 times greater incidence in Blacks versus whites. The leading causes of kidney disease and kidney failure in African Americans is hypertension and diabetes, or a combination of both. Next slide. So this is just a slide detailing the fact that there's a greater, and I'm not sure if you can actually read all the details. I'm not going to go over every detail in the slide, but it just basically depicts the fact that there's over 110,000 individuals on the national kidney transplant waiting list. And African Americans are overrepresented in terms of needing kidney transplants. We only represent about 13% of the US population, yet we represent upwards of 35% of the individuals on the kidney transplant waiting list. And so that is a remarkable disparity that we need to address, that needs to be addressed. Next slide. So as I said, we're only 12% of the population. We represent up to 35% of the population in need of a kidney transplant. We wait longer to receive a kidney transplant. After kidney transplantation, we have a higher incidence of rejection. Next slide. So this is just a graph, a chart indicating how many Caucasians, Blacks, Hispanics, Asians, and others are awaiting kidney transplantation in relationship to the percentage that they represent in the population. And you can see African Americans, as I indicated, are in much greater need of kidney transplantation compared to the percentage that we occupy in the population. Next slide. So there are different ways to address kidney failure, and we're going to talk about kidney transplantation. But the best way to go about addressing kidney disease is to try to prevent the onset of kidney disease in the first place. Next slide. And the best way to do that is through controlling and treating high blood pressure and diabetes, and trying to prevent high blood pressure, diabetes, and obesity. So this is just a study that we performed at Cleveland Clinic showing that if African Americans are fortunate enough to have a living donor, the graft survival of that kidney will survive just as long as it does in Caucasian Americans. But if African Americans receive deceased donor kidneys, there is a lower graft survival or rate of survival of that kidney transplant compared to their white counterparts at all time points. Next slide. So the take-home message for that is that we need to be more aggressive in trying to identify living donor transplants for African Americans whenever possible. Next slide. So this is just a cartoon graphic in terms of where transplant surgeons place the kidney down in the pelvis. Your original kidneys are higher up on the slide. We generally do not remove those kidneys, but we place the new kidney lower down in the pelvic area. Next slide. So we'll just flip through these slides. This is just a typical picture of a kidney that we're preparing prior to transplantation. You see the artery, the vein, the ureter. Next slide. Next slide. That's just a picture of it having been implanted into the recipient. So next slide. And so we can skip that. So there are various ways in which to increase the pool of available organs, or potential pool for organs available for transplantation. There, as I said, are over 110,000 awaiting a kidney transplant. However, yearly, and this hasn't really changed dramatically, there's approximately only 25,000 kidney transplants performed a year. So you can see that the number of people needing a transplant far outweighs the supply of organs available for transplantation. And again, that just underscores the fact that we need to get more living donors. We need more people to sign their organ donor cards. So then there's other surgical techniques that surgeons use to preserve or reduce the discard rate of deceased donor kidneys. And this is just a book, and I'm sure everybody in the audience wants to run out and read this chapter that I wrote in this particular surgical textbook on ways to expand the organ donor pool. Next slide. Again, we're just going to flip through these. These are just different ways to reconstruct kidneys with multiple vessels in the side. Next slide. You can conjoin these two arteries together. Next slide. That's a picture of those two arteries that I joined together in preparation for the transplant. Next slide. Next slide, just another example. And okay, and this is a kidney with multiple arteries. Not every transplant center will be aggressive enough to try to implant kidneys with multiple arteries, but at Cleveland Clinic, over the years when I was there, we imported a lot of kidneys, and I transplanted a number of kidneys with multiple arteries. Next slide. We can skip that. I will actually at some point do a whole dedicated program on music and medicine related to surgical renal transplantation. Unfortunately, there are situations where children, adolescents will pass away, and we're grateful to the families when they consent to allow the transplant center to utilize those kidneys, procure those kidneys to help save another person's life. These are kidneys, two small kidneys from a small child. Next slide. And those are the same kidneys that are reconstructed. You can see how diminutive those kidneys are compared to the size of my fingers, my hands. Next slide. Those kidneys, when we implant them, that's what they look like when implanted down into the pelvic area. Those kidneys will hypertrophy and grow to about 80% of the size of adult kidneys. Next slide, over several months. So next slide. That's just what those kidneys look like after having been implanted. So, all right. So no, that's what I wanted to show the audience. And again, we're going to have an opportunity later on during this March National Kidney Health Month to go into more detail about transplantation. So look forward to announcements about that. I wanted to invite in our co-host, Mr. Jerome Brown and Nurse Jonathan Branch. You guys, did I put you to sleep?
Not at all.
Okay.
Not at all.
Yeah, thanks for being here. I know Jonathan, as a cardiac nurse at Walter Reed, I'm sure you take care of kidneys also with kidney disease and kidney failure and on dialysis.
Well, we do have patients who do come to us with kidney disease and with kidney failure. Yeah. Like I've said before, I work mainly in cardiology. I do work in the cardiac cath lab, but we always check BUN and creatinine, and we check kidney function, and that mainly determines how much contrast we can give a patient for a particular case. So that's one reason. And if we do have a patient in end-stage renal disease, we're kind of limited to what we can do for them cardiac-wise doing a particular procedure.
So you mentioned BUN and creatinine; those are
right.
laboratory blood tests. Tests that from drawing a blood specimen that we use to determine what an individual's kidney function is. So, very important. So, Jerome, what's going on?
What's going on, my friends?
Just
hey,
look forward to
What's
the
up,
start
Jay?
of spring training. Get out to the baseball park.
Hey, first of all, Doc, happy birthday to you.
Yeah.
And congratulations to the Northwestern, because you guys did make the tournament. So much respect. Ohio State didn't make it this time, but we got you next year.
Well, we're gonna beat Ohio State in football next year, also. I'm sure.
Oh man, come on! Now you're talking crazy.
If we play them, I got to look at the schedule. So
yeah. Well,
so you know what? We have yeah.
Well, speaking of the tournament, my alma mater, Virginia Commonwealth University, did make it in, and we're playing. Yes, VCU made it in, and we're playing St. Mary's. They're fifth seeded. They're school out in California. But also, since I live in the Washington D.C. area, I have to mention that Howard University made it in. And, HU, they made it in, and they are playing Kansas, which is the number 1 seeded team. So, yeah, they're going to get demolished. But anyway.
You never know in the tournament. You never know.
You never know. You never know.
So, yeah, we have some remarkable guests here that I'm very appreciative that their willingness to share their personal stories. And what they went through. I mean, they're both kidney transplant recipients, and not everybody. I mean, they just were willing to go ahead and share for the benefit of others, so others would learn about what it is to have developed kidney disease and get a kidney transplant. Because there are a lot of people out there that have kidney disease or headed towards transplant, and they don't know really what to expect. I know the doctors and nurses at the transplant centers do spend time educating patients, but a lot of times when you go through that pre-transplant evaluation, there's so much going on that you can't really absorb all that information. And it's very important also for the families of these individuals to be aware of issues pertaining to kidney disease and kidney transplantation, the importance of living organ donation as well. So, yeah, let's go ahead and welcome our guest, Mr. Ray Freeman and Mr. LaVance Lining, to the platform.
Welcome.
Hey, there you guys are. Hey.
Welcome.
Happy kidney.
I always say, Ray. Oh, yes, you too. So Ray always puts me to shame. I mean, he should be on GQ magazine, and LaVance. I mean, you always outcool me. You with your hat, and you're so cool that I've never been able to be that cool before.
I didn't get accepted in medical school. You got to fit in when you get in.
Okay. So how are you guys doing, LaVance and Ray? How are you guys doing this evening?
I'm doing good, Doc. I want to thank Jerome and Jonathan for being part of this music and medicine. I'm doing great. It'll be sitting at 10 years, Doc, in December. Haven't had a problem yet. Not one problem. Not one.
Good for you, Ray. You showing off, brother.
I like that. I like that. That's motivation.
I seen Jonathan do it.
That's good.
I'm easing up on 8 years. I'll be 8 years in April 5th.
Wow.
I got my transplant on Easter Sunday, April 5th, 2015.
Congratulations.
Watching the Cavaliers game and waiting on the second test results to come back for it to be a match. And the guy from transportation came and said, "Hey, you ready to go?" I said, "Go where?" He said, "Oh, you're transplant." I'm like, "Oh, it's a match," And so I had to call my wife and tell her that I'm going into surgery. And she rushed down, and Dr. Modlin actually held the show up to allow my wife to drive down and let her scrub up and come in the room before my transplant. And so it was very accommodating. I got a chance to have my iPad and interview Dr. Modlin before the surgery. Let my wife see the kidney, et cetera. So it was a great experience. And I just encourage people that are not registered organ donors to become one. You know, the hardest thing for most of us to do as minorities is find a living donor, you know, that qualifies. You know, I tell people all the time, I tried to get my brother, you know, I had two brothers, younger brothers. They were like, yeah, bro, I'll give you my kidney. I'm like, look, if you give me your kidney, you'd be bringing it in the Crown Royal bag because that's all you do is drink. I said, if I get your kidney, I'm going to still need another kidney. So just be careful, you know, especially with the influx of medical marijuana. You know, you get the wrong kidney, you go into rehab right after your surgery. So just be careful whose kidney you accept as a living donor.
So how long? So LaVance, how long were you? How long before the transplant were you diagnosed, or how many years before were you diagnosed with kidney disease?
It happened really quick, Dr. Modlin. With me being, you know, I got out of the military in 1989, out of the Army, where I was running 6 miles a day, you know, in great shape, 23 years old, you know, and I was going to the store, and the neon sign was blurry. And I'm wiping my eyes. I'm like, why is this sign so blurry? And that's how I became a diabetic. You know, my blood sugar was 996 when I got diagnosed. You know, normal is 80 to 120. So I lost 40 pounds in 5 days. I thought I had the flu. So I'm drinking these big gulp cups of tea with honey, lemon, and sugar in it. So I'm just spiking my blood sugar, thinking I'm bailing myself out of the flu. And so I went to the emergency room. My mouth was stuck together. I was so dehydrated. They gave me 5 IV bags before I made it to the floor to be officially diagnosed as a diabetic, a type 1 diabetic with no diabetic education. That was my onset into the realm of being threatened with CKD, you know, chronic kidney disease. And so, you know, time rocked on. You know, I was mismanaged myself because when you're 23, you feel like you're a superhero. And I was in denial with all the nurses. The diabetic nurses told me, Mr. Lining, you know, you could be on dialysis by the time you're 30. I'm like, oh, 30 is a long way off. I'm only 23. I got time. And guess what? Time rocked on. And eventually I was in kidney failure. You know, when I found out, I was in stage 4 of kidney failure, you know, and that's really end stage, you know. And so I found out in 2012. And so you think from 1989 to 2012, I mismanaged my diabetes to the point of I killed 2 kidneys. You know, I killed 2 kidneys with my mismanagement of my diabetes. You know, never had high blood pressure. You know, I was such an avid runner growing up that, you know, they always used to say my blood pressure was so low. They're like, why is your blood pressure? You should be dizzy. I'm like, no, I'm good. You know, but I was a sprinter, you know, and so never had any trouble with blood pressure. But guess what? Once my diabetes went bad, it drug my blood pressure down with it. So my blood pressure was now, you know, you're full of fluid from your kidney failure. You guys know this already. My blood pressure was 300 over 200 or 200 over 110 or, you know, some crazy numbers that most people get rushed to the hospital for, you know? And so it was amazing that my body was able to bounce back and even sustain itself and be strong enough to be in surgery for 7.5 hours to get my transplant. You know, you think under normal circumstances, I was so full of fluid. I went from 189 to like 265, and it was all fluid. My body was retaining that much fluid with my end-stage renal disease.
Hey, Ray, what was your situation? How did you meet Doc, and how did this come about here?
My situation is a little different. I had started having like symptoms in 2010. So 2010, I was seeing my socks, my ankles would swell up.
Okay.
And I was dehydrated all the time. I always wanted to have some fluids. And Dr. Modlin, to tell you, I'm a pro athlete. So me playing with the Denver Broncos for 2.5 seasons, then coming back to Cleveland, I was active. You know, I was playing racquetball. I was playing baseball. And then I wasn't the same guy I was. I mean, I'm like 46 years old, and I was just not feeling up to par. So what I started doing is going to a different hospital here in Cleveland, and just like he said, I thought I had the flu. I thought it was something else, and I went to a medic clinic, and they were like, "Oh yeah, just take this, you'll be fine." I started taking that. It made me sick. I started actually vomiting. And the only thing I could take is oranges. Lemonade and oranges is the only thing that would settle me. And it wasn't good me drinking lemonade and taking all those oranges. But if I ate an orange, I wouldn't throw up. So my sister came home and she came by my house and I was just sluggish on the couch. She's like, you're getting up. You're going to the hospital today. And it was a Saturday. And I went down to the Cleveland Clinic and I sat there and they took me in. They did all these tests. And then they said, are you okay? And they was asking me questions. I'm like, yeah, I'm okay. Because, I'm an athlete. And when, like he said, he was out of the military 23. I'm out of the National Football League. I mean, I didn't play with 400-pound linemen. That stuff don't stop me. And, I'm strong. I'm still lifting weights. But when they sat down there and told me my kidney was only functioning like 17%, it blew my mind to be that young, 46-year-old man, your kidney function at 17. And this is before Dr. Modlin. They was like, you're going to have a kidney transplant or you're going to be on dialysis the rest of your life. And I was like, I'm not going to be on dialysis the rest of my life. Some of Dr. Modlin's old actual employees, along with a good friend of mine, Mayor Brad Sellers, they said, you need to go see Dr. Modlin. He's this, he's that. So I had an actual surgeon that they already lined up, but I wanted a brother. So I wanted a brother to work with me. No offense to any good kidney transplant doctor, but I wanted a brother of my kind to work on me. I met Dr. Modlin. We hit it off from day one. He's been my friend. We did well over 5 or 6 documentaries. We did everything, kidney walks. He's really became my friend. He's my go-to. And now I'm the spokesman in Northeast Ohio, talk to people. I didn't actually seen 10 of my friends while I was going through the kidney transplant die. So I had to go see their families and deal with that. But I've actually talked to over 40 guys and girls that were in need of a transplant, got a transplant. Dr. Modlin has talked about 10 of them. And I think I'm just the ambassador and spokesperson for that person because, hey, I had a little notoriety. I'm going to take that notoriety and people like me. So, yeah, I'm going to tell you what you don't do and what you should do. So I'm hard on them. I mean, the 30 I deal with, I'm hard on them. They call me Mr. Freeman. They go over in their actual, in their weight. They drink too much during their dialysis, all that. I get on them. So they're drinking pops. So don't drink none of that stuff. So, Dr. Modlin knows I read every actual ingredients on whatever I eat and whatever it is, what's in it. I don't do sugar. I don't do salt. I don't do none of that stuff. I mean, I'm very militant, like LaVance was. I don't take too much stuff in my body. So
right. So
and that's why your kidney has survived for so long. Both of you guys have taken care of the kidney. When you get a kidney transplant, the audience may know you have to take anti-rejection medication. Otherwise, the kidney will reject because it's from another individual body will recognize that as foreign tissue. Yeah.
Now is that for the rest of your life?
So Ray, you got a living donor. It's for the rest of your life, yeah. Yeah. So Ray got a living donor, and again, you look at African Americans, we're less likely to be able to identify a living donor in many situations because our friends, our loved ones who would otherwise be willing to donate, they themselves a lot of times have diabetes or high blood pressure. So anybody who wishes to donate has to undergo a very rigorous medical evaluation to make sure that they can safely donate, that if they donate, they themselves are not going to go into kidney failure. Most individuals have 2 kidneys, and we know that it's safe to give 1 kidney, but you have to go through a thorough evaluation in order to do so. You guys touched on a lot of stuff that's very important. The number one sign or symptom of an individual who has early kidney disease is that there are no signs or symptoms in most situations.
Really?
In later, no signs or symptoms underscores why, and Jonathan knows this as a nurse, you have to undergo routine preventative health screenings for your blood pressure, to check your diabetes, your cholesterol. I mean, there are rare instances where individuals will have hereditary kidney disease, polycystic kidney, things like that. But in most situations in blacks, it's high blood pressure, diabetes. And we need to educate our families and friends about the importance of living donation. Like I said, African Americans are less likely to identify a living donor. We wait 2 to 4 times, 5 times longer in the kidney transplant waiting list. who the individuals on the list who get transplanted, there are a lot of variables who determine, where you are on the waiting list. It depends on the match between the prospective donor and the recipient. So your place on the list varies, all the time. But it also depends on your blood type and how many antibodies that you have against the prospective donor. Yeah. So there's a lot that goes into it. One thing I always say, if somebody is waiting for a kidney transplant, if they're on dialysis, or even if they're not on dialysis, if possible, unless it's a medical situation, emergency, try to avoid getting any blood transfusions, because getting blood transfusions from exogenous donors will increase your antibody levels against prospective donors. So there's a lot that goes into it. We're going to have another special show on this as well. But Ray was talking about the swelling of the ankles, nausea and vomiting. LaVance was talking about that you were urinating more frequently. Some people will urinate more frequently. It's a more dilute urine. Some people will have a decreased frequency of urination as their kidneys start to shut down. So,
and
again,
guess what, Doc?
Yes.
Real quick, my donor was a cadaver, and I had to, of course, accept the organ. They gave me some history on her. She was a 24-year-old female that died in Indiana from a heroin overdose, and she had Hep C, and I also had Hep C from one tattoo. Guys, one tattoo. Imagine I got one tattoo in Atlanta on it there at lunchtime at work, and got hepatitis C, but I never got any interferon treatment for it, and I never drank, and so my liver was fine. And so that enabled me to take that kidney from that female that died from that opioid overdose, take the medicine that they came up with in the interim. God knew what he was doing. He had me wait just enough time so they could cure my Hep C with medicine right after my transplant. So I'm like, sure, give me that Hep C kidney, because I already got Hep C, so let's go on, give me that kidney, and let's knock out this Hep C and cure it, not only in my existing kidneys, but with my new kidney, and so it was great. Only issue I had, guys, is because it was a female and she was 24. I was 48 when I got my transplant. Every now and then, guys, she wanted to turn up on me. So my wife went to get her eyelashes done. When she got there, I was already to get mine done. I'm laying back in the chair like, yeah, make them real long. I don't know how I get here. I'm going to get my nails done next. I don't know what's going on. So be careful who your donor is, because it backfired on me. I got a butterfly tattoo on my back.
Every now and then he do this.
Yeah. Hold up now. I got a butterfly on my back.
Wow. Right. I ain't hear it either. He said he got a back tattoo.
I heard lower back. Not even my shoulders.
But one thing Dr. Modlin touched on, and it affected me, and Dr. Modlin actually gave me the toolage and the knowledge of this, and it's your antigens. Once you go on the kidney, whatever list you go on, you got to look for a match in your donor. Cadaver is not the best, and I know LaVance went through that way. I had a living donor, but you got to look at matches. You got to look, okay, if I had chicken pox at a certain time, did my actual donor have chicken pox? Did I have these type of antigens? Do they match my antigens? Do they match my blood type? I was a B positive. My donor was a B positive, but it's a lot of things that go into it. But we just got to wake up the actual African-American population about it. And Dr. Modlin's doing a great job. I've probably been to 17 of his men's minority events, and they're the best events. And it just opens up the mind of us to know, like, okay, what I'm going to do. Because like you all said in the past, guys before 1950 or 1954, they're like, oh, okay, I'm going to just die. I need a kidney. Right. You're going to be the same, Now we have modern technology. You have great surgeons like Dr. Modlin that can do it possibly in his sleep, but he did a great job with me. He filmed it. He filmed LaVance, and it just walked me through it. I wasn't nervous, wasn't scared, none of that stuff. I was like, let's get ready. Let's go. It was like a football.
I'll tell you what.
It was like a football. He didn't put it in backwards.
No, I haven't had one problem. I haven't been in the hospital in 9 years.
Oh,
that sounds great.
Beautiful.
Knock on wood.
That's outstanding. Yeah,
That's beautiful.
that's outstanding.
And you know,
and Dr.
Jonathan, Jonathan and Jerome, I can't tell you what it means to me to have two of my recipients and the confidence that they showed,
It's amazing.
showed in me, and I mean, all of these years, I mean, they've taken care of the kidney, very responsibly. They've reached out to others, trying to educate others about the importance of, how to get a kidney transplant, how to take care of that transplant. Because again, not everybody takes care of these organs. There's not enough to go around. So exactly. I can't thank these two guys enough for the confidence that you placed in me, and I'm really humbled and honored. I mean, seriously.
And guess what, guys? Real quick, I met Dr. Modlin. I saw him on TV on a commercial for the Minority Men's Health Fair. Called his office, set up an appointment to meet him as a urologist so I could beg him to be my transplant surgeon. I said, same thing is right. I'm like, look, I want an African-American working on me because, it ain't personal. It's just business. I want a black man working on my black kidney. I didn't get a black kidney, but it's B positive. I'm B positive too, Ray. My kidney was B positive. And, but I just wanted a brother, and, our first appointment, we talked for 90 minutes, and of course he did the prostate thing on me, and but I was good there, and so we went to work on the kidney after that, and 2 years later after I met him, I got my transplant. And guess what? My kidney is from the same state that Dr. Modlin is from.
Wow.
Indiana.
Wow.
All right.
Wow.
All right.
The thing is, you touched on something very important. The race of the donor doesn't really matter. So I mean, we can transplant African American kidneys into whites and vice versa. But actually, if we can get more African American donors, then there will be a better match with that African American recipient. So we desperately need to even start educating these young people about the importance of signing their organ donor card. Obviously, we don't want anything to happen to them, obviously. But they say, don't pass away and take your organs to heaven. Heaven knows we need them here.
Right.
And you
United
are
States
living examples.
Dr. Modlin. Go ahead. I'm sorry. Go ahead, Dr. Modlin.
No, go ahead. What was that?
No, I was saying we need to move to the opt out of being a posthumous donor like Europe, as opposed to us automatically being declined by default. That would clear a lot of that up, because, had a situation pretty close to my family where the person wanted to be an organ tissue donor, and he died suddenly of a heart attack. And the family was like, nope, I don't want that. Get out of the room. When the harvesting organization came there to get the organ and the tissue, they were like, nope, don't touch my husband. And so what do you do? Everybody should be an implied donor until you opt out.
And some states are going to that.
Good.
And I want to give a shout out. Yeah, I want to give a shout out to Life Bank of Ohio. They are the organ procurement organization in Northeast Ohio. The CEO, Mr. Gordon Bowen, is a good friend of mine. They do outstanding work over at Life Bank. They communicate very well with the donor families. The recipients of deceased donors to be able to meet, the donor families. Depends on, the wishes of the donor family, but in many situations there have been reunions where those individuals, the donor families, will see that their loved one still lives on, as a transplant in the bodies of the transplant recipient. Russell, do we have that video, that no donors video? Because LaVance talked about willingness for individuals to sign up on the organ donor registry. Do we have that video that we can play? It's a 2-minute video.
Okay.
And this is just a animated depiction as to why many African Americans are reluctant to register to be organ donors.
Yeah, our community.
Yeah, we don't really see it playing.
Yeah, our community is just scared of any type of health getting cut on. My uncle died. He needed a heart procedure, but he didn't want to get cut on, so he just opted to die.
Yeah.
You know, so many of our peoples are like that. Nah, don't do no surgery on me. It's just a hangnail. I don't want no surgery. You know what I mean? Like, come on, man. We have to get over that because we are killing ourselves and knocking off 10, 15, 20 years off of our lifespans because of this type of phobia that we have amongst our peoples. And it just comes from traditions passed down and not trusting science, not trusting people. It's a distrust type of situation.
Yeah, and some of that's cultural and
exactly
religious. So
it is.
Congratulations, Mr. Smith. You've passed your driver's test. Would you like to register as an organ donor? Mr. Smith? Mr. Smith? They promised they'd give him the heart transplant. The heart attack came early. They said there was nothing that they could do.
So the doctors let Dad die? Mom, I'm scared of dying. Sometimes, I think the doctors let Dad die.
Honey, the doctors did all they could do. Your uncle needs a lung transplant.
Will the doctors make sure he gets one?
He's on the waiting list, no guarantee.
We're losing him. We're losing him. Call the death.
Mr. Smith? Mr. Smith? Would you like to register as an organ donor?
Nah, I'm good.
So like you were saying, Jerome, there's a lot of distrust. A lot of people out there think that if you sign that organ donor registry card, and if the doctors and nurses know that if you're an organ donor, they're going to let you die if you're in the ER or ICU, so they can use that organ for somebody else. That doesn't happen. The process whereby organ or prospective organ donors are identified, deceased donors, that is completely separated. There's an organ procurement organization that manages those patients. It's completely independent of the transplanting surgeon. So there's no conflict of interest there. I mean, nor would there be. But again, that's a perception. I think that perception is more rampant or more prevalent in the Black community.
Oh, yeah. You think about the shot. You think about, the vaccine. People were citing Tuskegee when they had no idea what Tuskegee is, know how to spell it.
Exactly.
It's like they withheld the medicine in Tuskegee. We're trying to give you medicine, in the vaccine.
Yeah, but Jerome is correct on that. I mean, I get pushback, and those 30 patients I've helped and maybe 15 have acquired a transplant. They're scared of it. They don't want to do a transplant. It's like, no, they're going to take it. They have this mystery, this African-American mystery. Oh, they want to kill us. They're going to take our organs. Well, if you die, you got to do some good with it. I mean, you got to leave something for somebody else to enjoy life. And why would you not give them, if you can, if you have a good living donor and you still have body parts? I mean, they have a misconception of it. So
yeah,
right.
like you're going to need
I'll tell you what, Ray,
in heaven. Like you're going to need it in heaven.
Exactly. Yeah. And
just in case I come back.
Just
in case I come back.
Exactly.
Right. I might need that.
Well, Ray,
I might need that.
and like I say, Ray, you've helped countless more than 30 people. You don't really know all of the people's lives that you've touched. Those 30 people, they've went on and they've educated other people. So no, I mean,
that's true.
You guys need to have your white coats. You need your official white coats as healthcare provider. A healthcare provider doesn't have to be a doctor or nurse. It's somebody such as yourself, the both of you, who educate people about important, medical and health related issues. LaVance, as I understand, do you have some video that you wanted to show us?
I believe I sent in some video, to share. I'm doing TikTok, though I feel like, TikTok is relative to the person, because at 56, I feel like my time is running out sometimes. So TikTok is very valid in my life sometimes, especially after being on a ventilator for 8 days and in a hospital for 27 with COVID pneumonia. Even though I was vaccinated and boosted, I still got it. But nothing makes you appreciate life more than the taste of a ventilator for 8 days. So yeah, I did send in some video, and hopefully it plays. But I try to be funny in conversation, so we don't have to depend on video. But roll it if you got it.
Yeah, they got white dresses, white hats, white stockings, white shoes, everything except medical knowledge, right? Oh yeah, they look like they can help. They look like they can be of assistance. I'm not bad. For you older saints, I got the sugar. I got that sugar. And one Sunday I take insulin, come to church, praising God. I get dizzy, fall out. I'm laying down my back, looking at the lights. Out the corner of my eye, I see a white streak, y'all. Church nurse, I'm like, thank God. I said, please, can you go to the car and get my insulin? I'm a diabetic, I didn't take my medication. She said, shh, don't talk, let the Lord have his way. She said, shh, just talk to him. Oh, just talk to him. Talk to him. I said, I'll be with him in 2 more minutes. If he don't get to that car,
I am sitting here in the surgical room 24 with the surgical team prepping for my transplant, waiting on the renowned Dr. Charles Modlin to get here, and the rest of the team. And then I'll be gone for 4 to 6 hours.
Yeah, security?
Yeah.
Where's security?
I can't get through. I'm going to leave the towel right there.
This is the kidney? Oh my gosh. Wow.
He's going to reattach all the vessels that are the white or free things sticking out there, and
oh my God, amazing. Amazing.
Well, all I know is I'm happy for you. It's been a while. You've been waiting for a while. And we have a good kidney for you here at Cleveland Clinic. We're going to do a great job. We have the #1 class team ready and assembled for you on this Easter day. So we're happy that you're going to be here with us, and we're ready to get started.
Miracles, yeah, yeah, yeah.
And wheeled into the operating room knowing that I was going to get a second chance. It was fantastic. It's not even a good enough word to describe it.
Outstanding. I'm happy we were able to document that for you. And
man, that's crazy. I can't believe it was me. It happened so quick. I think it was a divine intervention, for me to even see you on TV, and just be attracted to your blackness, first of all, as a physician. And I have a cousin that's a physician in Houston, and me and him both. He's 3 years older than me. We both said we were teenagers. I want to be a comedian. Oh, me too. I'm Eddie Murphy. Me too. He went to Houston and became a doctor. I became a comedian. I'm like, when did the outlook change? You didn't update me on what you were going to do with your life. So he's a physician now, but and only was the 2% of physicians are Black men. And so my wife, shout out to my wife that was there, Tina Lining, who is the senior director of diversity, equity, and inclusive excellence at the Case Western Reserve School of Medicine. So she gets a chance to impact lives of not only leaders at the School of Medicine, but also faculty and students. And so my life has come full circle. My wife is from East Cleveland, Ohio. Went to Case, graduated from Case. I went to prison and caught a case, and so everything is great. It's all relative. And you're in DC, Brother Branch. I'm sure you heard of Paul Berry on the news there. That's my wife's uncle. He was just here visiting us 2 weeks ago. Yep. Yeah. Paul Berry is my wife's uncle, and cool guy. He came down and stayed 4 or 5 days with us. So just a lot of Black history in my family, and I'm the first transplant recipient out of my family that I know of. I just sent off for Ancestry DNA kit, not only to find my family, but in case I need another kidney, at least I know who to ask. So it's sneaky. It's like, put you on the D. You match DNA wise. Let's do the whole workup. So So I thank God for that, and I'm as happy for Ray as I am for myself. Because not many people get the gift and talk about it. So many people are so private. So worried about people judging them.
Correct.
For their transplant. It's like, how could that be negative? How could that be something that demarginalizes you or stigmatizes you when you got a kidney, you're still alive, and you're helping other people realize that it's available for them too?
Yeah. Now I got a question for the both of you. First, Ray, same question, gentlemen. What do you appreciate more now that you have the kidney than you didn't appreciate prior to having a healthy kidney? Go ahead, Ray.
For me, I didn't tell you guys, but and Dr. Modlin knows this, I'm in charge of a national urban school board, public school board members, and they affect children every day. So from this surgery, I have went to different levels. I would have never thought I would have been on a national stage for 60,000 school board members and 9,000 people listening to what I got to say. So if you get that attention of people and they're speaking, they're like, oh, he was a kidney transplant. It moves that crowd. It moves that conversation when I walk off that stage. So I can touch children going through this. And I've seen children pass away with the same kidney that me and LaVance went through. So what for me is God gave me another chance to help people. I always help people, but I'm helping them at a higher level than I could ever do ever in my life. So
you become an advocate.
Very good.
Very much so.
And that's beautiful, man. Because not just the kids, people your age that are strong, NFL, athletes that would not ever think about, a kidney. You're making them open their eyes like, man, my boy Ray, he went through it. I maybe, need to do something too. So I like that, man. And okay, LaVance, what was your life-changing moment?
You get that kidney and goes to the NFL, right? You get it early enough. Past that physical. That scar ain't what it looked like. I would say for me, like Ray, I didn't get a chance to talk about it. Most people wouldn't talk about it at this point in our session, is that I am also in recovery. I'm from drug addiction. I'm 17 years recovered from a love affair with cocaine.
Good for you, man.
And so thank you. All glory to God. And guess what? Today, I get to go into prisons, treatment centers, schools, colleges, etc., and tell people that it's nothing special about me. I only had to change one thing. Everything. That's all I had to do. And so I include my kidney transplant. I let people know that your life, a lot of times, is in your hands. Your choices you make are your choices. Some choices can be reversed through time, and changing your behavior, So I had to change my behavior once I got my kidney. like Ray, I don't do salt, sugar. I don't do anything. As much as I love pomegranate and red grapefruit, I haven't had it in 8 years. Those are my restrictions for my transplant. But guess what? I'll trade that all day for my 1.01 creatinine that I have for my blood work last week.
That's perfect.
I'm happy to be here and happy to be of service to those that doubt that somebody wants to kill you and take your kidney and sell it off to somebody in China or something, And like you say, Dr. Molly, I think you should talk about the people that go offshore and get these bad transplant surgeries that come stumbling back to Cleveland Clinic when they have their kidney in their hand and the other part in their body. Like, oh, help.
Yeah. We've seen that before, actually. Yeah, that's a true situation. And we obviously discourage that.
Yeah, it's not a good look.
And Doc, I want to commend you because these two gentlemen are here today, large in part from your work. That's God's work right there, because they've been given 5, 10, 15 years of extra life, extra love, everything they do for the people in each of their circles. So that's affecting a lot of people with just these two gentlemen right here. You guys are something else.
And I have to thank God, and I'm only in the position I am. My dad taught me this years ago, and I fully understand. I'm only in this position because of people who came before me, made sacrifices, and gave me opportunities they never had. And again, when it comes to kidney transplantation, there's a whole team involved: the anesthesiologist, the scrub nurse, the circulating nurse, the floor nurses,
shout out to the staff.
Yeah. I mean, the immunologist, it goes on and on and on.
Just as important, man. Just as important.
And guess what? Who people never mention is the housekeeping. They keep the room clean, not only the surgical room, but the bedroom that me and Ray had to lay in and make sure we didn't get no infection.
For sure.
From our kidneys. A good friend of mine who was a comedian as well just passed away from his transplant because he got an infection and didn't survive. It's real, but everybody, it takes more than the surgeon to be successful in a transplant situation. But thank God Dr. Modlin paid attention in school and passed his clinicals and didn't phone it in. He said, oh, yeah, I know this. I got it. Yeah, I read that last week.
Well, I'll tell you what. I mean, I would never make it as a comedian or a professional athlete. So again,
or a singer.
See, Jerome and Jonathan know that I've tried to.
He can play a horn.
Well, a little bit, I used to be good at the trumpet, but Jonathan and Jerome know that I've tried to, tell a few jokes here and there on music and medicine, and haven't gone over too well. But
really,
he'd be trying to rap and everything, LaVance. He be trying to rap. He's like, oh.
That's why y'all the co-hosts it's a payoff to keep quiet, huh?
Yeah.
I'll let you guys sit with me as long as you keep a secret.
Right. Hey, he pays through Cash App. Ain't that something?
So LaVance, where can people see your comedy shows? How can they access your
look me up on TikTok. I think it's LaVance Laughs 216. I'm on Facebook, LaVance Lining, Instagram. I think TikTok is LaVance Sees You or something like that. But just look up LaVance. You may run into my son, LaVance Jr., who's a civil engineer, but also a great artist, a great painter. He's all over Instagram. Talented kid, never took an art class, and can paint. And guess what? And can dunk. He's the only lining ever to touch a rim that wasn't putting it up on a ladder to drill it in, you know what I'm saying? So the next generation is always supposed to do better than the previous. So I'm happy at least one lining has dunked the basketball in life. I was like Ray, I was a football player, and I was fast, but my high school didn't have a football team. I went to Cleveland School of Arts, so it was all about acting and dancing, etc. And I tried to go play for Cleveland Heights, but they wouldn't give me a transfer. But I would have been a wide receiver and a running back. I was like, and put you in mind of Eric Metcalf. I had that kind of speed, that kind of quickness, but thank God I didn't do it because my body couldn't handle it.
Yeah.
I got small bones.
You'd have been fine. You'd have been fine, man. You'd have been fine.
I was running. I've been running.
Yeah.
Hey Ray, were you part of
Ray, you did
the fumble game?
Yes, I was.
Oh Lord,
I wasn't going to out him. I knew that. I didn't want to out him.
I shouldn't have answered that. I should
You
not
could
have
have told
answered
him to pass. Yeah, on the 2-yard
Which
line.
game was it? I'm sorry.
It's the AFC championship.
Yeah.
AFC
Cleveland
championship.
Browns and Denver Broncos.
Oh, okay.
Yeah, celebrated too early. Keep your arms on the ball.
Hey, things happen in life.
Well, I appreciate the manhood of coming back to Cleveland as an ex Denver Bronco.
Yeah.
So that's when the
Jerome,
Broncos beat the Browns.
Correct.
Yep.
That's correct. They would have went to.
So not only that, Jerome.
Oh, that's too bad.
Oh Lord.
Yeah.
Pull a plug.
Okay.
Doc, pull a plug.
That's too
Pull a
bad.
plug.
What is that? Hey, I'm gonna send you some gear.
Russ, help
But
me,
Jerome,
somebody,
not only that, but Ray works with Brad Sellers, who was on the team when Michael Jordan beat the Cavs.
Oh,
Yep.
Lord have
Yep.
mercy.
Over Craig
Yep,
Eagle.
I know Mayor Brad. Yep.
Oh Lord,
Yeah.
this is just
That's
getting worse
funny.
by the second.
That's funny.
Come on, Jerome.
This is getting worse by the second. Hey, go Cavs. That's all I can say right now.
Hey, I'm saying go
And
Cavs.
go Northwestern. Go Howard U.
You know.
So
BCU,
Ray, how
go
can
Rams.
we and the listening audience support your efforts with your national school board initiatives?
I'll put it on the podcast, and Russell can put it on there. Just how they can get a hold of me on the national front and even on the local front. You know, I work with probably 10 different public schools here in Cleveland Heights, Bedford, Maple, two other Garfield. So I deal with them, but my main purpose is to get out the information. The information, and someone said it, you know, you got to meet them where they are. I mean, you got to meet these kids where they are. You can't try to teach them or do this. Like if a child can do it at home, sometimes we have to open up that avenue of Zoom. So I'll give it to Russell to put it on there next time.
Excellent. And thank you for that, Ray. It means a lot for people to see people look like them in leadership, especially in education. Okay. You know, it's not a lot of that going on, you know, and the same thing, you know, you think about anything, a real personalized grassroots delivery speaks volumes more than a clinical type of setting of somebody coming in and saying, don't use drugs. Drugs can hurt you. It's like, no, tell somebody, hey, I used to be a drug addict, you know? And so people listen to me, prisoners listen to me. And the best thing about speaking in prison, y'all, is I get to leave when I'm done. How about that? So it's good. But guess what? People's right. I see men that haven't laughed in 5, 10, 20 years sometimes cracking up with tears running out of their eyes because of my gift. I don't take it lightly. I know that my willingness to go, God's going to give me what to say to touch those men's hearts, you know, and that's what it's about. Let them know I see you, I understand you. And guess what? There's still hope. You know, as long as you still got life in your body, there's still hope when you get out of prison to turn your life around, you know, and you can do it, you know. And so same thing with the school system. You know, kids have to know that I can be a Ray Freeman. I can be a Charles Modlin. I can be Jerome Brown. I can be Jonathan Branch, you know. It's available.
Amen.
Yeah.
And our man behind the scenes, Russell Johnson, you know, our producer, you know.
Russ.
Plan.
The man with the links. Good editing on the video
sets
too.
all this up.
Yeah.
Thanks, I appreciate it. Appreciate it.
You can't technology.
So like I said, I predict Northwestern is going to win the NCAA this year. So you can put you can bet. I'm not saying go bet money, but you can place your bets on it.
I was about to tell you, you can stop right now. You're starting to talk a little bit too much, Doc. You know.
Okay.
What do y'all think about? They got billionaires encouraging us to go gamble. You know, Jamie Foxx, all of these mega millionaires telling you to go vote like your life is going to be like their life. You know,
they already got that check.
Jamie Foxx, sure, I'll go bet my money.
Yeah, he got that check. You know,
Ohio up. I mean, it's tearing our state up. It's tearing Ohio up.
It is.
we already had an issue. People were going to West Virginia. Now they can just go downtown. You imagine how many 401ks have been cashed in early? Well, I guess you're not going to college. You're going to
you go right on the phone, man. Right on the phone.
Exactly.
Yeah.
You're right about that.
Yeah.
I think we're the second highest in the country.
Yeah.
Second highest. And we're not the biggest state either. So that's showing you how many people in Ohio.
I think we second to New York. I think
Second to New York.
Yeah.
Ohio.
Mm-hmm.
Yep.
Yeah.
So look at where you skip.
So we're gonna have to have a
Florida, Cali. Come on, man.
Yeah, so we're going to have a program on gambling addiction, also.
Yeah.
Yep.
But looks like we're up on time for this program. So I just wanted to thank LaVance and Ray for joining us, and Jonathan and Jerome for co-hosting. Thanks for the listening audience. There'll be a rebroadcast of this program. We encourage everybody to share the link to the program. A lot was talked about this evening about kidney disease, chronic kidney failure, end-stage renal disease, kidney transplantation, things that you need to know. And again, we appreciate your testimonials, LaVance and Ray, and we look forward to working with you in the future as well.
Great.
But with that, being said, we're all going to come out and watch you perform, LaVance, on stage, your comedy. So
I will let you know. I'll give you an update. By the time this airs, I'll have something local.
Okay.
Local or local.
Okay, well, for joining,
LOCO.
and thanks for being here. Okay. We'll see you guys later. And
Peace,
thanks,
guys.
everybody on the audience.